Good morning. Today is about understanding how we can improve patient safety, how that affects both academic institutions but also health systems, and what innovations people are bringing to this space.
Healthcare education and training is in a crisis.
The way in which we prepare people for practice needs to change.
How are we preparing them for that complexity, for interprofessional working, because that is ultimately going to help them in the resilience and wanting to stay within the profession.
What's great about virtual reality simulation is it allows us to give students a chance to fail, see the consequences of their failure, get feedback about how to make it better, then they can reset and try again.
Delivering more and more in-person simulation isn't really feasible from a logistical point of view, from a staffing point of view, but this is a way to give students more simulation, which they're crying out for and which they really, really value, at a way that's scalable.
Students can actually practice at a time and a place that works for them. They can rehearse, they can prepare, they can understand their performance success and the things they need to improve based on the feedback metrics they get.
We've utilised OMS alongside face-to-face simulation, which has really demonstrated really effective. One of the key things that we're capturing is evaluation data. So it's not just there and then after completing simulation learning, but it's that follow-up data, looking at the long term. Has that influenced how many residents are having falls? Are we seeing a reduction in choking rates, for example, and how that impact of that immersive learning has then impacted practice?
We've got too many students and not enough capacity to hold and train that many students properly. I do think virtual reality has got a big place for that. I think OMS is a really great system for it. It does offer us the flexibility to give students access to things that we can't necessarily do in a face-to-face environment.
How can we ensure that our students are still making the most of those placement environments? And if we educate them within SIM in regards to, well, look for these opportunities, is this going to help improve that capacity issue and that sort of equity that we're talking about?
We need to prepare our student nurses. We use simulation to prepare our students to manage microaggressions. We've set up simulations that address these concerns and allow our students a safe place to practice and rehearse those skills.
Implementation really needs to be really thought through. Know what technology you're building, know why, and know how to really change their practice so that it's valuable to the students.
One of the things that OMS does really well is the support that's given through the whole process. We've got someone that we can just easily go to and we know we're going to get good advice and they're going to be helpful.
You need to replace less than 5% of your clinical hours to kind of break even. I think when you start to really look through that maths, you can see that this isn't like an expensive investment.
And so I would say, let's stop asking if we should do this and ask how quickly can we do this.